Welcome to the Straight Talk podcast series from Blueback Health. I'm Eric Thompson. In our series, we look to abandon a scorecard and give you simple, straightforward information on how we can work together to improve healthcare financing, and ultimately the health of your employees and their families. This is not fluff. It's hard-hitting, direct, and we hope that you enjoy what we bring to the table. As always, thank you for tuning in, and please be on the lookout for our next podcast, Straight Talk. Thank you. Well, I want to welcome everyone to the first Straight Talk podcast by Blueback Health. And as we looked at our first victims, kiddingly, we are here to ultimately find disruptors, but also folks that can help lead the charge in giving everyone an opportunity to improve their health, and then ultimately start to lower the cost of health insurance, and a number of other things, because we're also just really interested in people. And so today I want to welcome Ashok Subramanian, the CEO of Centivo. And so Ashok, welcome, and thanks for joining in on this, the first podcast of Straight Talk.
Thank you, Eric. It's a pleasure to be your inaugural visitor.
Yeah, I think today what we want to do is we want to go through a few things. Again, touching on a little bit of what I kind of led into. I think it's very intriguing to have opportunities to speak with folks that actually are disrupting, are starting things, are running things, are transitioning companies. And you really have fit all of that. So let's start with Centivo. What motivated you? And you also have a great management team that seems to follow you. But what motivated you to start this company?
Eric, absolutely, and appreciate the question. I think, we all step back as we get a little bit older and realize we know increasingly less about small amounts of things. And one of the things that, I think over my career I've gotten deeper on is this area of healthcare and the area of how do people choose things and what motivates individuals to buy products. That was at the basis of a company that I helped build prior to Centivo called Liaison. And one of the things that we've noticed in our data, and this is supported in the Medicare market, it's supported in the individual market, as well as in the employer market, is that employees, individuals, are more willing to choose alternative types of models compared to a traditional open access broad network than what their employers believe that they're willing to. And the reason for that is employers typically are focused on how do I cater to my average employee and how do I minimize noise? Employees themselves are mostly focused on what are my personal circumstances. And that personal circumstance has over the last decade been increasingly defined by affordability. Mm-hmm. And we can go into more stats and details on this as we get deeper, Eric. But in short, to use the football analogy, the affordability of healthcare has simply outkicked the wage growth in this country for a long time. And that has opened up people's minds to think about new ways to access care that doesn't compromise on quality, but makes sure that people can actually afford to get the medicine that they need. And at the root of Centivo is that focus on restoring affordability as goal number 1, 2, and 3.
And so when you look at it, when did it kind of come to you that you needed to do something in this regard and disrupt is not really the right word to use. It's improve, and be a change agent to the inefficiencies and excess costs that we have. I'll just drop, I read a post before we started this from one of our state senators who has joined the review board of the insurance rate filings. And he happens to be a physician. And the whole positioning is it's an insurance problem, but it's not, and so with that, when did you kind of, say, I've got to just do this?
Yeah, it's, I think there's never sort of a single trigger moment, but I think a couple of things came together that made this feel like it was the right moment in time. The first was some of the data that we had that showed employees are really not loyal to traditional carriers, that they are highly price sensitive and benefit sensitive. And so that opened our eyes to, if there were a new model, a new approach, a new product construction, that it would be attractive to that end user, that end consumer. The other trigger, though, was over the last 5 to 7 years, some very large employers like Disney, like Boeing, like Intel looked at their own data in the markets in which they do business and basically said, if we see in our data the fact that there are 12, 18, 20, 30 percentage point differences in total cost of care from one healthcare system to the other, some of which may literally be across the street from each other. And if our insurance carrier partners are either unable or unwilling to exploit those differences, we've got to take matters into our own hands. And so employers of that size, of that scale, of that sophistication basically said, we're going to contract directly and we're going to find ways to get at that value. And we're going to administer contracts that enable our employees to have a more affordable option built around these direct contracts. So the fact that most of America is employed by small to mid-sized business, but that the largest employers were seeing opportunities to make things better, putting those things together basically said, there's an opportunity here. There's an opportunity to help an organization that might not have 150,000 people in Central Florida like a Disney does, but that their 150 people have exactly the same needs as those 150,000 people working at the theme parks. And that eventually led to, there's got to be a way that we can build this, but build this to make it work for every company in America, not just the select few.
So when we look at that, again, it's all kind of an accumulation as to what ultimately led to you saying, we've got to do this. We've got to start this company. As you started to build it and you looked at the things that you just mentioned, and then I'm sure a lot more, was there one gorilla in the room? Was it, a carrier? Was it the provider margins? Was it the inefficiency of care? Was it members not willing to change? What was there one gorilla, or was it all encompassing?
Yeah. So the primary motivation for me and I think our team is these two numbers. In 1980, the average American spent $250 out of pocket for healthcare. In the year 2020, that number is now $2,000. That is simply untenable. And there's no justification in terms of quality improvement, in terms of access improvement, that can support an 8-fold increase in the average out-of-pocket spend. So the first gorilla, to use your term, is there wouldn't be a problem to be solved here if healthcare were affordable for that average American. But instead, they've had an 8 times increase out of pocket and certainly don't have the wage increases to support that. When you peel that onion one step further, it's like, okay, well, is that inevitable? Is there no way to solve that problem structurally or economically? And the answer to that is no, because as you then cited in your question, Eric, a couple of other mini gorillas. Well, those out-of-pocket cost shifts have happened while corporate profits are at an all-time high, while carrier and pharmacy benefit manager profits and margins and share prices are at all-time highs. There is so much cash on balance sheets of a number of these organizations that they're engaging in more and more M&A and other activity than ever before. And so part of what makes this solution attractive is the fact that there's plenty of money out there to pay for everybody's healthcare and do it in a very fair and affordable way. It's just that the allocations of those dollars today are hyper inefficient, rewarding low value care, rewarding higher cost providers, rewarding intermediaries who make money on percentages of total volume in the system as opposed to actual value created. And Those mini gorillas get us to how do you solve the big nut? And that big nut is there's just too many people who are hurting because they're making choices between food and housing and medicine and day-to-day expenses for their kids when in America in the year 2021, that's just not right.
Well, and we absolutely agree with that. As we work with our clients and we start to look at, again, the data and we hear the stories, we all know, especially some work, and you participated in this with, United Way and analytics. We have that scenario where people just can't afford it. And when you look at the waste that happens, and when I say waste, it's the system doesn't support the person in need. It's fragmented. So tell me a little bit about when you look at the Centivo platform, how do you drown out some of that noise that is prevalent in and dominates the traditional health insurance company employer sponsored plan? How does Centivo, squelch a lot of that noise?
Yeah, so Eric, we often start many of our conversations and presentations with the concept of myths in healthcare. And there's sort of four key myths that we often try to address. The first one of those myths is that it is impossible to offer a richer benefit to employees without simply paying more. That's been the pervasive logic of it's going to cost me, the company, more money if I'm going to offer my employees a better benefit. And that's a Faustian bargain. Well, that goes back to what we were just talking about, which is if you reallocate dollars, there's a way to enrich those benefits by getting the efficiencies not on the demand side, not, and by demand side I mean the shoulders, the backs of the consumer, of the average American worker, but instead the supply side by focusing on more efficient purchasing of healthcare services, more efficient purchasing of pharmacy benefits, and so on. At the core of that strategy to hit that myth head on is number one, we have to stop believing that the average individual wants a network that includes every single doctor in America. That's what we've built towards. Are there some people who want that? Yes. Is it easier for a company to administer that? Because, to what we said earlier, there are no complaints if literally every doctor and hospital is in a network. That's true too. But back to the level of the person, a family of four, every family is pretty good at making decisions around who they are, where they live, what their likely needs are, and thinking through the composition of the providers in the network is something that we've had good experience that people can make good choices on. And there's a history to this. It's not limited to models like Centivo, models in Connecticut around the exchange, around chamber type programs, models in other markets like Kaiser, where people have made choices as to, do I want a broad national carrier network, or do I want something that's more curated, more built for purpose, centered around certain healthcare entities, which Kaiser is at the end of the day, both a health plan and a health system. So there are good examples of individuals being able to effectively trade the thickness of the provider directory attached to their health plan in exchange for a higher value, more affordable, simpler, clearer experience. And that really is the fulcrum that we address head on. And we bring transparency from a cost perspective to help that employee and that employer understand what's in it for you. What's in it for you if you're willing to think about your coverage in a bit of a different way.
So give me an example of that transparency.
So one good example in the Connecticut market is there has been a lot of attention, research, symposia, events around data that has been studied by the RAND Corporation that's very specifically looked at hospital prices, something that historically has been under a veil, buried deep inside of various contracts and various network arrangements. A good example, without naming sort of specific providers, is within the same county of the state of Connecticut for the same services with no appreciable difference in quality. We're talking about reasonably transactional episodes, not brain surgery for a pediatric case. But for things like imaging and fairly straightforward outpatient surgery, there are variations of one hospital or one healthcare entity being able to provide the service at 150% of Medicare. In other words, 1.5 times the rate that the government would pay for that service for a Medicare patient, up to as much as 350% of Medicare. Differences of 2 to 2.25x for the same service. It is impossible to educate a member or an employee around those types of differences for every episode of care for every provider when, to be clear, if they're shopping inside of a typical network, at best, they're thinking in network, out of network, and
Right.
they're thinking a benefit level for a type of service. So, what we found is in order to get employees, families to really take the spirit of that data and act upon it in a way that helps lower cost for them and for their employers, the way to do it is to not link them to a website or have them call a call center and have that work, but instead to really build the core of that network, the providers, the hospital systems around those entities that the data shows are the most cost effective. And the second part of this is to say, don't take our word for it. Take the word of your primary care partner, because what we've seen and what others have shown, there's a great study at Yale, from Yale rather, that helped make this clear, that 2/3 of non-primary care sources of utilization of the healthcare system are driven by the advice of that referring physician. And so matching and pairing high quality, cost effective providers that are at the core of the network and the steerage or guidance into that network by the trusted primary care partner. You take one of those two things alone and you don't get the same outcome, but you put the two of those things together and you get cost effective and you get trust and loyalty on the side of the member. And we found that that combination is what helps drive the better outcomes.
And so then when we look at that, obviously you are going into hospital systems, discussing Centivo, the value proposition model, what you are hoping to accomplish with your, client partners and their individuals. Is there one theme you're hearing from the hospital systems? Because they too likely have frustrations regardless of people beating down the door saying cost of care.
Yeah, it's a really good question. And it's one I encourage employers, benefit advisors, and others. You've really studied up on this, Eric, deeply over the years, and not many of your peers necessarily have. But I encourage everyone to sort of really think about and have conversations with providers in your community, even if it's not about a direct contract per se. It's about what motivates you. What are your business issues? What are your challenges? And to that point, the themes that we hear, number one, I want to build a relationship with people in my community. I don't want someone coming here for a lab test one day and then I don't see them for a year. Or maybe they pop in for a physical, one member of their family, but I don't see the other members of their family. Health systems and hospitals are increasingly interested in building long multi-year relationships with patients. And the way they're trying to do that is by investing in technology, investing in access, making it easy to schedule an appointment, pay your bill, get a referral through a portal. And so there's a number of things that they're doing to make it much more of a streamlined experience when you use the healthcare system. And that's of great importance to them, and it's of benefit to the member as well. And then the second thing that we hear a lot about, which is a direct consequence of the high deductibles and the cost shifting that we've all collectively undertaken over the last 20 years, is that providers never got in the business of being debt collectors. And we put them in that business by basically saying, let's hope if we put a deductible at the front end of a plan that somebody is going to think and shop and ask questions. Well, the reality is we've got a little bit of that. We got a little bit of a, okay, do I need the x-ray, or can I get an x-ray instead of an MRI? Will a generic do instead of a brand name? There's definitely some shopping and question asking. But when the cost of care goes up, when the episode of care is more anxiety driven, people do what their doctors tell them to do. And by the way, they should. They're not medical experts, doctors are. And that deductible has put caregivers in a position of basically trying to chase patients for money. And what we hear from hospitals is they write off anywhere from 12 to 23% of their expected revenue in the form of a bad debt write off because they simply can't collect. What we've done to help address that, which drives better rates, better value for the member and the employer, is to basically say if we can structurally take that out of the benefit design, revert to something that is more copay based, no or low deductible, can we get value from the fact that you're not having to do the chasing and have that money work for the employer and work for the employee? And that's what's happened in the course of these contract negotiations is there's an element of value by working more closely with these healthcare enterprises, but there's an element of value by listening to their business needs and their challenges and solving for them in the core structure of how the health plan is built.
Absolutely. And I think, when we look at distribution and understanding the options that exist for an employer and how that changes the delivery of healthcare, the financing of healthcare, how the member or patient, employee, whatever we want to label, interacts with it. The biggest thing that we see is when there is someone in need, and we usually see it with a more serious case, the first thing they worry about is my insurance going to pay for it versus what do I have to do to get better or combat this bad diagnosis. And so that's the unfortunate thing we see. And I know that with your model, it's very different. The doctor, hospital system, they're in control of the care. And that's impressive with how you have turned that around relative to what we see in the traditional insurance carrier model. So before we transition on to some other things, what are your preliminary results? What are you kind of seeing with your clients that are in the Centivo model?
Yeah, so Eric, the results have been really, really great. And, I think there's three dimensions on which we look at the results. So the first is obviously financial. If there's not a financial gain, then we all understand in this industry that the status quo bias is to kind of stay with what you have. So there's got to be financial juice. What we're seeing is compared to market benchmarks for cost adjusted on a geography basis, we're seeing that the total cost, both employer and employee portion together, is about 31% lower than what's attained through a traditional network. That savings is currently being split about 50-50 between the employer and the employee. So the employer is taking about half of that in savings, 15-16% savings, real good number. And the other half is funding an enrichment in the benefit level. And to put precision on that, a typical benefit plan in America today, according to the Kaiser Family Foundation, covers about 77 cents on the dollar. What's known amongst benefit nerds like you and me, Eric, is actuarial value. That number under Centivo is now is an average of 92%. So the average American is only spending, if they're on that plan, 8 cents on the dollar. The plan is covering 92%. That takes money to do, and that's being financed by that total savings, as we talked about earlier. So pretty impressive financial results, and it comes directly from this re-architecture of a smarter network and better value. The other pieces of value are the member experience and the clinical results, because it might feel good to save money, but if it's because people are avoiding medications and not getting healthcare, well, that's going to feel good for about a year and is going to cause a lot of problems downstream. So to be brief, we're seeing increases in what we call good utilization. Primary care is up, preventive care is up, emergency room and other sources of bad utilization, if I may, is actually going down. So it's a healthy substitution of more expensive, less efficient care being reduced and better care, more longitudinal relationship-based care being rewarded and actually going up. So we walk through that with employers in the financial model where we're pretty transparent. We kind of say, you should expect to have some portions of your cost stack go up a little bit. You should feel good about that. It's the equivalent of making an investment in R&D in your business. And at the same time, you are going to see some flab in your health plan today, and you should see that flab come down. And emergency room is a great example of that. And then last but not least, Eric, the Moneyball question that we often get is, well, do members keep the plan in year two? And the answer is yes. So we've seen across the board net new increases in membership when available as an option second year, and really good loyalty as well. So far so good. It's going really well. But I think the core is a philosophical issue that we're constantly working with the benefit advisor and the purchaser, the employer community on, which is the core assumption that the large institutions that are the health insurance carriers are always the best equipped to drive the best cost and the best value because they're big. That is the, if I may, the old wives' tale or the fable in this industry, that we're kind of working with other innovators to take a direct shot at. And obviously forums like this help sort of get that message out. But there is this sort of lazy trope in the business that, well, there's no way you can save money compared to working with the largest companies in America. And obviously we're chipping away at that narrative one day at a time.
Yeah, you absolutely are. And I think just for the audience, when you look at the Centivo model, it is a self-insured health plan model. And so if we look at that, Ashok, just give me the quick answer, if there is one. What's the smallest size employer from an employee eligible for the health benefit headcount? What's really the smallest employer that would fit into the Centivo model? And obviously everything above that line is, there as well.
Yeah, so the rules for self-insurance vary a little bit market by market. We typically go down to 51 employees. So organizations of less than 50 are not ones we've historically served, and those tend to be fully insured today. In some markets like New York, the statutory minimum size is 100 employees. But in places like Connecticut and elsewhere, self-insurance down to 51 is becoming increasingly comfortable. And I think if I could add just one short point here, Eric, there's this perception that fully insured is safe and self-insured is risky. And this is probably a topic for another podcast, another time, with others in the industry. But the very brief point on this is fully insured carriers effectively provide a 1-year delayed rating to the claim experience that an organization had in that year. And so there's no escaping a high claim year when you're fully insured, and when you're self-funded, you are going to pay as you go for some of those claims. But when you're having a pretty good year, like many employers did in a COVID world with lower utilization, there is very little benefit of that organizations accrue when they're fully insured. And when you're self-funded, you get that dividend literally on a week-to-week basis because you're not paying those claims. So longer conversation, definitely a good one to explore. But I think the opening for smaller companies to explore alternative financing has never been as wide open as it currently is. And obviously it takes a great advisor like the folks at Blueback to be able to do that.
Well, we appreciate that. And you're right. When we look at the financial models, whether it's fully insured, truly self-insured, what we call level funded, that's going to be another podcast, because as employers start to understand this, especially the smaller employers, things are changing rapidly, and the insurance carriers that traditionally sell a risk-bearing product, meaning fully insured, and they're at risk for it, they want out of that business. They don't want to horse trade with each carrier and shadow price. And that's happening as we see it today. So we're going to switch now, though. A lot of, great information on Centivo, on your construct, your philosophies, your goals, your big vision. I feel it's right on, it's on point with what we get frustrated with the traditional models. And we just appreciate you bringing that, and also giving us this opportunity to share Centivo with the audience. at the same time, when we look at what you've done, you've got a pretty interesting, work history. And so now as a person, since I've been fortunate to know you for a number of years, and you've been extremely giving of your time for events that we've had to bring out innovation and change and opportunities to employers. Talk to me a little bit about your work history. You started Centivo after kind of the liaison run. So maybe we go back and let's talk about liaison, and then we'll rewind a little more from there.
Yeah, I could even rewind a couple clicks earlier
Keep going.
to provide some context. So, I think like a lot of kids, I went to college. I didn't really know what to do. So I did what a lot of my friends were doing and applying to various firms that were coming onto campus to recruit. One of those companies was a consulting firm called McKinsey and Company. I hadn't really heard of them. I later learned they have a pretty good reputation in the market, but was fortunate to have an opportunity to work there. And consulting, I encourage any young person who's thinking about a career either in business or not-for-profit management, even public sector management, a short stint in consulting, a couple years at minimum. It provides such a unique exposure to an array of problems and people and methods and tools that's very hard to replicate. And the large consulting firms, and there are obviously many other terrific ones, just have such good training programs and camaraderie that it's a really unique and a special experience. So I always do encourage people to spend a couple years at consulting. I didn't have the startup bug. I was not a 12-year-old who had a lemonade stand and did a lot of things like that. I got that when I went out to business school on the West Coast, and we had a lot of exposure to entrepreneurs, to individuals. And what really got me was it wasn't so much the narrative of like start a company and there might be financial rewards and so on. What really appealed to me was the ability to build something from scratch, to do something that others, large companies, other existing companies weren't doing. So the problem solving and the mission piece of it were big. And the other piece that was sort of exciting for me was this idea of creating a culture, being able to, without any of the baggage of what one inherits at an existing company, have the blank canvas to set a culture, to as I think as Mahatma Gandhi once said, be the change that you like to see in the world. And so you have sort of the opportunity to do that when you start from scratch. And so the culture that we had at both our last company as well as this one is one that I'm very proud of, and one that's hard to achieve if you're not starting, from scratch. So I did, complete my MBA, went back to consulting, and then got the inspiration for Liaison. Liaison was about a 6.5-year run as an independent company, was acquired by a large benefit consulting firm, and continued on sort of in that form. But in short, I think what we were able to galvanize was the ability to use technology to help people make decisions around their benefit plans in an area that, candidly, for 60 years, open enrollment was reduced to human resources and a benefit advisor walking into a room with a lot of pizza and saying, here are your plans, take it or leave it. And we were able to sort of say, well, wait a second, Netflix and eHarmony and Amazon and all these other sectors of the economy were introducing concepts of choice and personalization. Why wouldn't health insurance and employee benefits have a similar approach? And so we were able to do that at Liaison. It was very effective. We had a good run. Obviously, things change over time when companies get acquired. But what I'm most proud of is even 7 years, 8 years at this point after the company was acquired, a number of things have happened in the industry around new apps and new tools and new approaches to personalization. But I often still hear things like, wow, like some of those innovations all go back to, if you do like a root cause analysis, to concepts and innovations that were pioneered back at Liaison that made it feel possible to be more digitally oriented, be more human centered. And I take that away pretty deeply from that experience.
Well, it's interesting because, some of your key employees management team, I was introduced to over 20 years ago when they were, kind of the beginning of this technology side. And and they follow you where you go. And you're also extremely humble when you just kind of rattle off, yeah, we did this and we sold it. And this is public, but you sold Liaison for $215 million. That's not a small acquisition price. And so, and you also have top talent that, like I said, follows you. So there's a reason for that. Give the audience a little insight when you look at starting a company and then you have capital investment. And again, this is also public knowledge. Your first was over 50 million. You got another, round of over 30 million, if I'm not mistaken. So what do the investors want to see relative to track record and also what you're attempting to do? Just give us a little peek into that world.
Yeah, it's sort of an interesting world. There are people like many things, there are people who live in those worlds and it all feels very normal. And then there's folks for whom they wouldn't even know where to start. And that was me. I had no idea where to start. And it was a long time ago, but those early days at Liaison, we started the company in 2007. We scraped together, an initial $1 million to help, build the business and find some early customers and launch a very early version of the product. Unfortunately, about 10 months into the Liaison experiment, something happened out of our control called the Great Recession. And capital pretty much dried up, and certainly capital for untested ideas and companies with materially no revenue and no clients. So we had an initial investor that said, sorry, you seem like nice people, but I've got to really batten down the hatches and focus on deploying capital to certain things because I don't know what's going to happen in the world. And we had some tough choices to make and some family conversations around, we're going to have to write checks ourselves. We're going to have to go without, paychecks for a while. And that has an impact, right? It's not just work life, it's home life.
Right.
It's, can you go out to dinner on Friday, as you might have done before? And sure, for the first couple of weeks, it may not make a difference, but when you get to, month 18, as it did in our case, without a paycheck, it becomes challenging. So the long sort of lead up, Eric, is ultimately the good venture capital investors are ones who are not looking for quick flips. They're not looking for, I'm going to buy a certain amount of shares today and I want to get a 2x or a 3x in a couple of years, and there's always pressure on how do we sell the company. The best investors truly start with a mindset of, where are there problems in the market? Problems can be viewed as either challenges or opportunities.
Right.
And can I find a team of people willing to look at this as a set of opportunities to go exploit, to use the word disrupt? I don't like the word disrupt either for healthcare, but there is an element of disruption, certainly that is driving the mindset here. And the amount of capital is typically commensurate with the size of the opportunity. So in the case of a Liaison, we raised about $30 million of capital to get to that outcome that you cited. It's a good amount of capital, don't get me wrong, it's a lot of money. But it's a fraction of the money that we need for something like what we're doing at Centivo, which is a full health plan.
Right.
We're paying claims, we're answering phone calls, we're building networks. We are looking large carriers in the eye, or looking employers in the eye and saying, you don't need that large carrier, you can work with us. That by definition needs a lot more capital than simply a technology point solution. And so that clearly changes the type of investor, the type of capital, and also the type of outcome that they're looking for. So I hope that helps with some framing of the situation.
Yeah, absolutely. I mean, I think, again, there's always teams of people, dreams that they're going to, change the world, go do something. You either bootstrap it, so when you look at the Great Recession, I was running a large brokerage and left to start Blueback Health. And I got my tax ID on January 8th of 2008. And so I get that. And then I watched clients, either fail or retract. Some kind of weathered it, but it's never it's never what you expect when you go into it, but at the same time, if you have the right people and the right team and you keep working at it, good things, I believe, 9 times out of 10 are going to happen. So now, that was helpful on, work history. I mean, McKinsey, I absolutely agree with you. When you look at the opportunity to go work for a company that is about process and consulting, and you get to touch a lot of things. Yesterday, I had coffee with, a woman that I used to work with when I was on the national account side, and for one large national account. And it was interesting catching up with her, talking about the people that we interacted with at that time and where they are now. Some are, head of HR, head of benefits for Fortune 500 companies. And it's always fun just to see how people progress. And I agree with your recommendation relative to getting that out of the gates consulting. So now let's get personal. Tell me a little bit about you, the person, your family growing up. What was that like?
Well, the dirtiest little secret about me is I'm a kid from Buffalo and I wear it on my sleeve.
You do.
So like a lot of folks from Buffalo do. But no, so I appreciate your asking, Eric. My parents were immigrants from India, came in the early 1970s. There's a wonderful photo dated November 1971. There's about 2 feet of snow in front of the apartment building that my parents had a one-bedroom apartment in the suburbs of Buffalo. And my mother, who had never left her small town in India up to that point, was wearing a traditional Indian sari and some open shoes, and standing in the 2 feet of snow, and certainly sub 32-degree weather. So quite a transition, but I think you add those two pieces of that narrative, the immigrant story, coming to this country with not a lot, and the Buffalo story, the blue collar kind of Rust Belt style work ethic, and I think those are two critical parts of who I am. Always trying to never believing that anything's given to you, because it's not. And also realizing that there's a lot of hardship in the world. There's hardship here at home. There's hardship abroad. And for those of us who are fortunate enough to have the time and space to think beyond, putting our next meal on the table, really addressing making people's lives better, and addressing some of those challenges, whether it's food, medicine, healthcare, what have you. Those are big motivators for me. From a Buffalo perspective, the other thing I would add is, I think, like we all are when we're kids, we don't know much beyond the circle of where we grew up, our neighborhood, the local park, the local school, our friends. Things have changed a little bit now. It's crazy what middle school and high school kids are doing, traveling all over, community service and so on. But that certainly wasn't the case when I was growing up. Short of a road trip to Philadelphia or what have you, I hadn't really, and I took trips to India. But I hadn't really seen much beyond, my own little world. One of the things that was interesting to me is I showed up at college in the 1990s, and people would ask the customary question, "Where are you from?" And I'd say Buffalo, and I was first confronted with this sort of reaction of, "Oh wow, that's a place that's struggling a bit." People would say, "Oh, I'm sorry. I've heard the city's dying, or the region's dying, or what have you." And I took that personally, and it just felt wrong that such a proud community, certainly it had fallen on some hard times, manufacturing going overseas, wiper industry, steel industry, and so on. But great people, great education, hardworking, good values. And so one of the things I've been most proud of is at both of these companies being able to reinvest back into, my hometown. And one of the things I recently posted on LinkedIn was the fact that Buffalo, for the first time in 70 years, is seeing growth and a resurgence in population. And a lot of that's being driven by innovation, by technology, by new industry, but a lot of that's being driven by new Americans, new immigrants, which I think is a great part of our story here in America. And it's a great part of communities that might not be considered hotbeds of immigration, like a Buffalo, New York.
Well, that was great. I think growing up in rural Maine, I can commiserate with that. And Buffalo is a little bit bigger than rural Maine, but I think the construct is kind of the same. And I think, with our son being up in Rochester, going to college, and spending time also in Buffalo, he loves it up there, and things are progressing. We can see it. And I did see recently your announcement where you've officially named Buffalo as the headquarters for Centivo. And so what lessons do you try to teach your kids now? What when you look at your experiences, what's that like? What's important to you?
Yeah, it's a great question. Obviously, the process of parenthood provides a whole new perspective on the world, on life, on seeing things through their eyes. My kids are still pretty small, so I have an 11-year-old, a 7-year-old. Um, you know, I think the couple of key things. My older son is a hockey player, and I love to use the metaphor with him that you've got a name on the front of your jersey and you've got a name on the back of your jersey, and they both count for something. The name on the front of the jersey counts for more. It's the team first, and it's making sure you represent the team and the organization well at all times. But the name on the back of the jersey counts for something as well, and it counts for there's people who've carried that name, over generations, and each of your actions needs to be respectful, of them. And I take that seriously, and hopefully he does as well. But it's great to see him sort of in his own way growing up to be a leader, sort of on the
Mm-hmm.
ice and off the ice, and taking kind of both that team approach, but also showing pride and showing respect for the name on the back of the jersey as well.
That was great. I think as we start to wrap up here, the purpose of our Straight Talk podcast is to exactly talk about these things very straight manner. And I think company culture is so critical. And I definitely have seen firsthand that the culture you've brought into companies like Centivo and Liaison is exactly in alignment with that straight talk, which is here's what we're doing, here's why we're doing it, here's how we would like to believe it's going to benefit you because we've designed it that way. But we're standing right here front and center, no excuses. And yes, things are going to go wrong with anything, but we're here. And I always say I'm appreciative of your time that you've given to us, whether it be getting up early and coming up to New Haven for, a Chamber of Commerce meeting, or educating our clients on the Liaison platform, which we've done back a few years back. I also think that when I think of you, you're just so humble. I mean, you worked your tail off in Buffalo. You went to, and you understate this because you don't bring it out, but you went to Princeton, molecular biology and public policy. Then you went to Stanford to get your MBA, and also international policy studies degree. And it's just, I say to folks, when I see that Ashok's doing something, I listen, and it's fun, but it's also important. And so I think that with that said, we really appreciate you giving of your time today to talk about Centevo, to talk about you and how you kind of got into some of these new business ventures, and also a little bit of who you are at your core. And so thank you so much, and look forward to seeing you very soon.
Absolutely. Thank you again. It was very kind, all of the things that you said. But look, credentials don't matter. Results do matter. And we are proud of the results that we've been able to achieve. We're proud of the partnerships that we fostered, including with Blueback Health. One of our partners often uses the term partnership is an overused phrase, but there are very few authentic partnerships. And I'm proud, Eric, to have developed what at least I believe is an authentic partnership, with you and your organization. So look forward to continuing our various dialogues, and thanks for having me.
Great. Thank you so much. And then as we close this out with the audience, if you want to learn more about some of the things that we talked about here, when we look at how do you finance a health plan differently than just buying insurance from a carrier, tell me more about what Centivo is doing and what the technology does and how to put the providers in control. By all means, reach out to us, and Ashok and his team, they are accessible and want to talk more about it, and we can actually, do something about problems that exist today, all with a focus on having people get the health care they need when they need it at hopefully a better price point than what we've had in the past for a lot of very important reasons. And so with that said, thank you for joining us today for the first episode of Straight Talk by Blueback Health. And look for our next episode, which is going to be coming up pretty quickly. So with that, thank you so much. Thank you to Direct Line Media and David for facilitating this for us today. And we will talk to everybody soon. Thank you.